Hello, everybody. I want to welcome you to this chat. My name is Jesse Lee. I'm the Online Programs Director here at the White House. Very sorry for the delay. As you can imagine, everybody here who's working on healthcare, their schedule is jam-packed. So I really want to thank HHS Secretary Kathleen Sebelius and Director of the Office of Health Reform, Nancy Ann DeParle, for taking some time to join us today. They've both done a bunch of chats over the last year. I would guess probably a dozen between them. So I want to thank them for kind of taking the time to engage on this throughout the course of this reform effort. And one thing I'll note is Secretary Sebelius just came this morning from a meeting with the insurance company leaders where she asked them to kind of justify the kind of alarming rate increases that we've seen across the country in various states. So I'll actually go ahead and turn it over to her if she wants to say a few words about that meeting.
Well, thanks, Jesse. Again, I'm sorry we're a bit late, but it's kind of a frantic time here, and pleased to have a chance to not only be with my great partner, Nancy Ann DeParle, but also with all of you. Today, I asked the insurance heads of 5 of the largest health insurance companies in America to come and talk to me for a bit about what in the world is going on, particularly in the individual and small group market, where WellPoint announced last month that they were raising rates up to 39% in California, but California is not alone. We heard from Pennsylvania and Michigan and states across this country where people are looking at these jaw-dropping increases. And I think it's important for us to ask companies that filed $12.7 billion profit statements for 2009, 50% more profit than they had in 2008, and then pivot and immediately tell some of their customers that they're going to have alarming rate increases, to ask them to come in and justify it. So today's meeting was a good discussion. The president joined us for a portion of time, shared with the CEOs one of his constituent letters, which is pretty typical. A woman from Ohio paying already $7,000 a year in health insurance premiums with the highest deductible that she can get. So she is trying to lower her premium by paying more out of pocket. In addition to the $7,000, which represented a 25% rate increase last year, she also has paid this year $4,000 in out-of-pocket costs for her drugs and copays, and she just got notice that she will have a 40% rate increase on top of the premium, and she is terrified. She's a cancer survivor, but cancer-free for 11 years. She has no place to go, no options, and said to the president, you know, I need your help, I need reform. So today's meeting was a step in the direction, but clearly it pointed out once again how desperately we need comprehensive reform, a new marketplace for people stuck in a market where they have at the mercy of insurance companies, and a new set of rules for insurance companies so they can no longer segregate people on the basis of who's been sick and who hasn't.
All right, thanks so much, and we'll go ahead and dive right in. I know Nancy Ann might have to leave after a little bit to go to the Hill and talk to the members of Congress working on this. So I'll start with a question. You know, just so you know, I'm looking at the chat, reading everything you guys are saying, so if you have questions, put them in the chat. This is a question we got about 5 minutes ago from the chat. It's from Jacqueline Melchiade Lawrence. She says, I have worked for 2 of the biggest insurance companies, and with confidence I could say that it's time we put an end to their practices and abuse of the American people. President Obama says that he plans to regulate to give control to the American people instead of insurance company bureaucrats and government bureaucrats. Please explain exactly how he's planning to do that.
Well, I'll start and then I'll turn it over to the person who will be leading a lot of this at HHS. What the president really wants to do, and she's captured it, is to give American families and small businesses more control over their own health care, and to really set some common sense rules of the road to help them with lowering their costs and keeping their premiums under control. And one of those mechanisms will be to give the state insurance commissioners more authority and ability to review premium increases every year, and then as a stopgap and a fallback to have the secretary help them with that and help with the National Association of Insurance Commissioners define what a reasonable rate increase is and what it isn't. And then we'll have some common sense rules of the road so we can guide this going forward. I mean, today we heard some discussion, you and I were chatting about before this chat began, about different reasons why premiums are going up, and frankly, it just doesn't add up. It doesn't add up to these 39 and 40% increases.
You bet.
And we're going to have some oversight over that in the future.
Well, I think Nancy Ann is absolutely right. It's first regulation. So you actually look at what the companies are paying out versus what they're collecting. And as Nancy Ann said, the numbers just don't add up. Medical trend is higher than regular inflation, but even WellPoint, who has asked for the almost 39% rate increase, said they're seeing a medical trend of about 13% each year. Well, 13% is a whole lot lower than 39%. So I think we have a right to know, where's that difference? Who's it going to? Is it going to CEO salaries and advertising and overhead? Where is it going? How many claims are they paying out? So one is oversight, and that's different. The president has a plan for more oversight. The Republican strategy is you should get rid of the regulation over insurance companies, allow them to basically operate anywhere they want, and that the market will take care of it. And I'm not so sure that market is working very well for folks. But in addition, we need a new market. Many people in the individual and small group market have no other choice. One company dominates, and it's basically pay our rates or go without insurance. That is really the choice facing way too many families. So you change the rules. You say you can't any longer say sick people have to be in one pool, and if you're healthy, you can have a lot of choices. We can cut off your benefits in the middle of a chemotherapy treatment, or we can cut off your benefits at the end of the year, or if you have to renew your insurance and you've used it during the course of the year, we can drop you. Those are the rules right now. Those would change under comprehensive health reform.
All right. By the way, I see a couple of people saying they're having trouble with the video on the Facebook page. If you go to whitehouse.gov/live, you'll have another video feed there that might work as well. We took a lot of questions on Twitter and Facebook even before the chat. This is one, it was kind of funny, but it kind of captured something about the whole kind of process versus substance issue, and I decided to kind of throw in the mix. And it was EJMCG on Twitter says, "I'm so over this healthcare reform. While I did recently pay $400 for a doctor visit because I am uninsured, I kind of don't feel like this bill is moving." So can you talk a little bit about where we're at, and for people that have been kind of frustrated with the process,
everybody.
Yeah, exactly.
Well, I think you heard the president yesterday. I hope everybody was watching. And as he said, everything that can be said about healthcare reform has been said, and has been said by just about everybody. He feels as though we've been talking about this for a year now. But let's be clear. We have a health reform bill that's passed both the House and the Senate now. And now what he's asking Congress to do is for the House to pass the Senate bill, and then to pass a targeted set of changes to improve on the Senate bill, changes that will improve the affordability, changes that will improve the rate review that the Secretary talked about, to make it stronger so people have more control over their health care. So some targeted changes, and then let's have a simple up or down vote. That's what he's asking for. And so he's put that in front of Congress, and we're spending all of our time. He's spending a lot of his time. I just left him, and he's been over there meeting with members of Congress. So we're going to get it done. And I hope the people who are writing in are not so over it that they just sit on their hands, because we really need them to show their support for getting this done now.
Okay. All right. This is kind of a more specific one that just came up in the chat, and let me see if I can find it here. Heather Nider, I think. I would like some clarification on Medicare reform. The verbiage used on discussions and literature continues to refer to Medicare, such as Part D, for seniors. There are others, such as myself, that are on Medicare A, B, D, C, and are not seniors. Will the reform to Medicare also apply to those that are disabled?
Well, I think what we're talking about is Medicare trust fund, first of all, being more solvent for more years. Right now, Medicare is scheduled, all of it, not just Part D, but all of it scheduled to be broke in 7 years. That's a pretty alarming place to be, with about 43 million seniors and disabled Americans relying on those health benefits. So the passage of health reform a smarter way to go forward. It enhances the strength of the trust fund for another 10 years. That is very good news. It also brings down some of the costs that we're overpaying for certain things. Medicare Advantage is a program that is really a seniors' choice program where private companies are competing with the fee-for-service traditional Medicare. The problem is, in order to get them into the marketplace about 10 years ago, Congress voluntarily put some extra money on the table, thought it would be a good competitive strategy. Well, we're still paying that extra money, and after 10 years, what we know is that the benefits that seniors receive, about the 20% of seniors who choose a Medicare Advantage plan, aren't making them healthier than the benefits of fee-for-service. So we're not getting rid of Medicare Advantage, we're just gonna stop paying the insurance company bonus, the extra amount. We're gonna have competitive bidding for durable medical equipment, trying to get some market strategies and stop overpaying for that. Lower the cost of drugs, which will help not only seniors, but clearly anybody in the disabled community who needs prescription drugs. So there are a whole series of, I think, ways that Medicare gets strengthened, and we're smarter about the money we spend going forward.
Yeah, can I just add two things? You alluded to this, Madam Secretary, but one is filling the donut hole. Right now, a lot of people who use Medicare get into this thing called the donut hole between around $2,500 in spending and around $5,000, and they're totally on their own. They have to spend their own dollars, so the prescription drug benefit kind of doesn't do them any good in there. There's about 8 million seniors a year, seniors or people with disabilities who use Medicare, who fall into that donut hole. So we're going to fill that donut hole through the president's proposal. And the other one is prevention benefits, which help everybody and are the right thing to do. But right now under Medicare, some of them you have to pay a copay for, and those will be free under this new plan.
All right.
Good points.
So a Net Zero, who I guess is a doctor, says, will my patients have direct access to me, or will they need an MD referral, which may lead to discrimination issues? And I guess, that touches on that general attack that we hear sometime about government getting between you and your doctor.
I think people will have a choice of plans the way members of Congress do right now. And they can look at whether or not they want a referral plan or a direct choice plan for families. The costs will vary. Right now, most people have no choices, but there won't be any bureaucrat, and for the first time, there won't be any insurance company executive that can pick and choose. You're sick, so you go over here. We're going to deny this coverage. We're going to cut off this treatment, which happens. I know, doctor, you see it time and time again, where you may recommend a procedure to a patient or a prescription only to find out that the insurance company won't pay for it, or they've decided to overrule your advice. That's really the kind of common sense rule change that the president talked about yesterday. There won't be a government bureaucrat standing between patients and their doctor, but there sure won't be an insurance company executive any longer standing between patients and their doctor.
All right. So this is kind of like one of these fundamental questions that we've tried to answer. If you go to whitehouse.gov, you'll see on the front page a link to information about the president's proposal. And from Frank Tellez, he just says, do people who are unemployed get health care under this proposal? If so, how?
Yes, and that's one of the things the president wanted to do, is to make sure that if someone loses their job or they're between jobs, they'll have a way to get health care. And the way they'll do that is through the exchange, which is a marketplace that will help people have the kinds of choices and the kinds of protections that members of Congress had. And there will be tax credits to help people who are lower income to be able to get affordable coverage. As well, Medicaid is going to be expanded. So people who are in the very lowest income levels will be able to get become members of Medicaid. So both of those things are happening. And for unemployed people, this should be a huge benefit.
And as the president said yesterday, it's one of the biggest tax cuts for middle class and working families ever, and it's a tax cut that goes directly to health care. So what we're doing is taking some money, most of which is being spent right now in the healthcare system, the $2 trillion each and every year that we're spending, and redirecting it to help working families, small business owners, self-employed folks out of work, buy health insurance, have that security for themselves and their families.
All right. So this is something we've heard all, like throughout this entire effort. Teresa Christine Buckland Mueller. Why can't we have a plan identical to senators and representatives? That would be true health reform.
Well, actually, that's exactly where we're headed. In the new exchange, we're talking about companies that, among others, currently deliver benefits in the Federal Employee Benefit Plan. And we're talking about a marketplace where you'll be able to pick and choose the exact same way members of Congress get to pick and choose. So we've heard those calls across this country. I went to a lot of town halls this summer. I've gotten letters. I've talked to folks, and they keep saying, if it's good enough for us, why isn't it good enough for members of Congress? And it's exactly what the president feels should happen, the kind of marketplace, the kind of choices exactly that members of Congress now pick and choose from.
All right. So we've got a couple questions like this, not the majority by any means, but we've got a couple people who have claimed actually the insurance companies are not, that profitable compared to some other industries. Their premiums are going up because health costs in general are going up. Can you address kind of where that balance lies a little bit?
Well, sure. I think, look, we don't have anything against companies making a profit or insurance companies making a profit. If we did, we wouldn't be basing this plan. The president's plan is based on the current system. He wants everyone to be able to get covered. He wants to lower costs. But I do think we were scratching our heads today trying to figure out why it is that premiums have been going up so much and why people are being priced out of coverage. And there's a practice that I've heard about, at least I have some friends who work in the industry as well, called purging, where you, when someone's experienced a lot of illnesses, you raise their rates so high. This happens in the individual market. You kind of wonder if that's what's going on. So I don't think we're saying that they can't make a profit or that we don't want them to be successful. We know a lot of good people work in the industry. I have friends who work in it. But we want them to be doing it in a way where they're using people's dollars, premium dollars that they're paying for their medical care, and that they're doing it in a prudent and wise fashion.
I think the other thing about an insurance market is it doesn't work if all the sick people are grouped together. And many, many companies do just that. They segregate off people who have an illness or whose family has an illness. By definition, their costs are going to be higher. Insurance is about balancing the risk, spreading the risk. So one of the things that is a business practice, and they'll admit that it's a business practice, even in companies where some rates may go up as much as 40%. Other people are not experiencing that. So the book of business in that insurance company looks very different. They pick and choose. And overall profits, as I say, the 5 largest health insurers, 4 of which were in the room today, had $12.7 billion of profit in 2008. 50% more than in 2009, 50% more than 2008. So they're doing pretty well. And yet, thousands of people are losing their coverage every day.
All right. That actually relates to another question we have here from Brenda Ford. A National Patients' Bill of Rights would fix a lot of the problems we have with insurance companies. I know that's something that we've talked about before. Can you talk about the relationship between like a Patients' Bill of Rights and health reform as it's looking right now?
Well, this bill has many of the same protections that were in the Patients' Bill of Rights, which was debated 10 years ago and was never able to pass Congress. And so we've made a lot of progress in getting those things and more in this bill. But that said, a lot of people say, gee, why don't we just pass the insurance reforms? We don't need to do all these other things. The problem is you can't just do the insurance reforms. We want to protect people from being denied coverage if they have a pre-existing condition. Many people have experienced that. I have it in my own family, where my brother couldn't change jobs because he had, his daughter had a pre-existing condition and they would lose their insurance. You can't fix that unless you get everyone covered, and that's part of the reason why piecemeal reform just doesn't work. We have to have a comprehensive reform, and that's how we get this Patients' Bill of Rights or Insurance Consumers' Bill of Rights, and that's what's part of this bill.
Well, I think there are also other really important parts of the bill. Lots of people understand that we've got to change from a sick care system to a well care system to a health system. So preventive care and early interventions, better ways to have doctors and hospitals work together so when a patient leaves, 1 out of the 5 doesn't come back within the first 30 days, lowering hospital infections. I mean, we've got a lot of pieces of this system that really don't serve America very well. As somebody said, you know, we pay more, we live sicker and die younger than most countries on earth, and we have to change all those pieces of the puzzle. And that's why comprehensive reform, not just the piece that deals with the insurance companies, but the underlying system really needs to be changed over time. And that's why this president feels so strongly that we really have to kind of tackle the whole thing at once. It has to be comprehensive or it still fails way too many people.
All right. I think we'll go with one last question. We'll let you guys both go back to work. It might be quick. Michael G. Glasser seems to be challenging us, claiming I'm not willing to ask this question. Why is this administration afraid to address ending the antitrust exemption?
We're not. We supported it. We strongly supported the bill that passed the House
Overwhelmingly.
last week. It was a bipartisan, more than 400 votes cast in favor of it, and we strongly supported it.
And I hope the Senate does the same thing, and so does the president. The president is very strongly in favor of it.
All right, well, Michael Glasser, I hope that answers your question.
Michael, write to your
That was
senators.
one of the easier questions we got.
All right, well, thanks again for coming. This won't be the end of our engagement with everybody out there in the public on this bill, but I think this is very informative. Thanks again, Nancy Ann. Thanks again, Kathleen. And we'll see you next time.